So now on to the beginning of the presentations for this session. Up first is a presentation from Leslie Ryan called Leveraging Digital Inclusion to Increase Access to Programs and Services. Thank you.
Hello, and thank you for having me today. My name is Leslie Ryan, and I am with the ALS Association. Today, I am going to present on a new initiative in development, ALS Connect, leveraging digital inclusion to increase access to programs and services. The ALS Association has a comprehensive mission focused on finding treatments and a cure for ALS while also empowering people to live their lives to the fullest. Focusing on the person living with ALS as well as the community of people surrounding them, the three mission areas of care services, research, and advocacy work together to advance this mission. The ALS Association is proud to provide programs and support to people living with ALS across the United States. Through our extensive network of chapters, we serve people living with ALS in every state, reaching over 20,000 people every year and partnering with over 180 ALS clinics and providers. For the majority of U.S. residents, using the internet is a common way to connect with family and friends, join group meetings, participate in educational opportunities, maintain employment, shop, search for information and resources, access personal entertainment, and install components for smart home technology. More recently, additional uses such as collecting medical information, participating in virtual medical appointments, and receiving non-medical home visits have expanded exponentially as organizations have modified their service delivery models. Digital inclusion is the ability of individuals and groups to access and use information and communication technologies. Digital inclusion encompasses not only access to the internet, but also the availability of hardware and software, relevant content and services, and training for the digital literacy skills required for effective use of information and communication technologies. The unintended consequences of the lack of digital inclusion are great. Without access, full participation in nearly every aspect of life is compromised. Unfortunately, not all people living with ALS and their families have access to the technology they need for digital inclusion. Studies show that 10 to 20% of Americans do not have access to the internet. As is true of internet adoption more broadly, home broadband adoption varies across demographic groups. Racial minorities, older adults, rural residents, and those with lower levels of education and income are less likely to have broadband service at home, although we know that those without internet connection are not limited to those groups. As ALS clinics and chapters pivot to virtual technology to deliver services and connect with patients, there are a significant number of people living with ALS who are unable to take advantage of these programs because of lack of connectivity. This leads to further isolation, decreased disease monitoring, and a decreased quality of life. While assessing the need to increase digital inclusion, we developed 4 pillars of the ALS Connect program: connection, opportunity, access, and participation. This program aims to be person-centric, identifying the areas and level of involvement that are important to each person living with ALS. Connectivity. Connectivity means that everyone will have reliable and affordable internet service that will accommodate multiple users at one time, and upload-download speeds that will allow for things like video connection. It means they have access to accessible and appropriate equipment. People not only need devices that they can connect with as their mobility changes, but also devices that have the capability to handle audio and video connection. Connectivity also means that the technology is installed and maintained for the best user experience and that support is readily available when needed. Once people are connected online, a world of opportunity awaits. From the comfort and safety of their home, people living with ALS and their caregivers have access to information, resources, training, and more. They can choose to attend an ALS support group that may not have been an option due to a travel burden. They can get caregiver training when it is relevant to them, rather than the one time it is offered in person. They can maintain employment or further their education. The opportunities are endless. When people are limited from accessing care and services from their healthcare team in person due to factors such as geography, fatigue, physical mobility, or a pandemic, connecting virtually becomes a safe and easy option. This allows everyone to have access to the quality of care they desire. Technology is also allowing access to clinical trials and other research through virtual connections. Virtual home visits from an ALS Association chapter staff member can include a home safety assessment and time for discussion around aspects related to the disease. When visits are held virtually, many times long-distance family members are also able to join, allowing them access to information as well. Our focus on participation reflects an important piece of our mission: to empower people affected by ALS to live their lives to the fullest. While this definition varies from person to person, there is a widespread benefit to being connected to participate in activities that bring purpose and joy. The benefits of digital inclusion are vast and span many different areas of well-being, as is reflected in the prior examples given. When we consider the ability to connect with others, we are reminded of the power of connection via social media as well. It enables people to connect to others who face similar challenges. Those who would otherwise be isolated can come together without the barriers of time and space. People are also able to find purpose by participating in advocacy and awareness events, and by continuing to manage their personal life through banking, bills, and shopping. The COVID-19 pandemic has demonstrated how critical it is to have consistent networks and technology to participate in society. For people with ALS, this is even more imperative. Most people living with ALS experience diminished physical capabilities that directly impact their quality of life, ability to connect with others, independence, participation in health monitoring and medical appointments, education, employment, and much more. Affordable and reliable internet service, technology, and user knowledge is no longer a luxury. It has become an essential means of accessing the world we now live in. ALS Connect was developed in response to this need. Our goal is that every person living with ALS in the United States has access to the connectivity, equipment, training, and support needed to participate in the broad scope of opportunities available to them through online connection. So where are we? As of today, we have identified 4 ALS Association chapters covering a 10-state area to participate in a proof of concept pilot. We have developed an assessment tool to help us identify the specific needs in the community. We are creating toolkits for both chapter staff and end users around technology and connection. We have identified options for hardware needed for optimal connection, and we have created maps to show high-speed internet coverage gaps across the pilot chapter area. Moving forward, we plan to complete in-depth assessments of up to 80 families who have been identified as having a need for connectivity. We will evaluate their specific challenges and develop appropriate solutions. We will implement the chapter pilot, evaluating for impact and making required modifications as needed. We will secure funding for the project from both corporate and foundation partners and plan to roll this out association-wide in the summer of 2020. So look for updates next year. Thank you so much for your time today. Please feel free to reach out with any questions, and I look forward to talking with you.
Thank you so much, Leslie. So this is really important area really to reach out to everyone. So it's something we really need to consider when talking about technology and access to technology, and even more so as we progress through through and out of the coronavirus pandemic. So maybe there's time for one question. If you do have any questions, you can ask this in one of two ways, through the chat on the screen, or you can raise your virtual hand and ask in the live forum as well. So let's give people a few seconds just to think of a question. If not, I will ask one, which is just about the scalability of this project and the problems you foresee by actually doing that.
That's a great question, and it's one of our main concerns and something that has been at the forefront of our thought and planning as we move forward with this program. We are hoping that the chapters in the pilot program will help us understand how to manage the scalability of this program and really help us come up with a strategic plan to move forward. At this point, and I'll address Andrea's question as well, the 4 chapters in the pilot program are our Northern New England chapter, which covers New Hampshire, Vermont, and Maine, our Massachusetts chapter, our Rocky Mountain chapter, which covers Colorado, Wyoming, and Utah, and then our Minnesota, North Dakota, South Dakota chapter. So we are addressing areas within the United States that have wide expanse of rural areas and a variety of different challenges that we know we'll face moving forward, which we hope will give us a really good view of how we can scale this project across the country.
Thank you. You've certainly given me something to think about in terms of how we can do something similar in the UK. So yeah, thank you so much. Really important piece of work. There is something else in the chat. 2 M&D Association Australia are lending iPads. So perhaps there's a question there about technology equipment and making that accessible as well.
Absolutely. And one thing we did want to focus on was many of our chapters, and I think associations across the world, do lend technology related to communication, but we wanted to broaden that scope and look at things just engagement and connectivity with people across the country, being able to do something like this, being able to attend a telehealth visit, and really expanding past just communication. And so we're excited to be able to offer that to people as we move forward.
Thank you. Thanks, Leslie.